we've spoken a lot about how health systems can adopt these programs and see outcomes. But for some health system where they have been using remote care programs already, what do you see is next? What is next in remote care in general and at MDRs specifically?
Yeah, in 2016 to 19, it was a lot of phone calling for chronic care management. There were a lot of Bluetooth devices out there in the market. A lot of times you had to use a smartphone in order to interact with the patient for vitals monitoring. And that technology has really evolved over the years. And so we're seeing more and more each month, more Medicare aged patients being comfortable with digital engagement, like text messaging, using an app back and forth, logging their own activities within an app or on a phone, and those are the really engaged patients that wouldn't have necessarily done well with just a phone call or just vitals inside their home. So we're actually able to offer an enhanced experience as patients get more and more comfortable using smartphones and technology. And then from the flip side perspective, we're seeing new devices on the market as well. So we're now integrated with with the two main continuous glucose monitoring devices that are on the market. And again, as patients get more comfortable with these technologies, we have to adapt to them as well. So that allows us to get more and more engagement, create value for the patient, but also value for the providers as well. We can use predictive analysis to then, based on the patient's trends from a CGM device, we can predict then how certain diets, foods, activities will actually affect their glucose levels throughout the day. And so when you provide that kind of value, now you have a program that was maybe in 2016 was just health coaching and calling people from the phone. Now you're getting all these extra interactions. Patients are more engaged. They know what the program is and they're using it on a more regular basis. So we're now bumped into 2024 where you have to provide these types of options and services for the patient, but also for the providers. They get a better background and better information from how they should treat their patients. And that was the original goal for CCM when these codes were first approved, and I think we are getting to that at a much higher level, especially in the last 2 to 3 years.
Yeah, that's exciting, and I believe you were referring to Dexcom as one of those partners, right?
Yeah, Dexcom and Libre, both of the continuous glucose monitors that are on the market provide a lot of valuable information for us to help talk to the patient, but also provide good, healthy living and patient-centered goals that they actually contribute to themselves, and we try not to talk about necessarily symptoms or how to treat their chronic condition, but how do you help them in their daily living, and also what are their goals that they want to do. So those are usually lifestyle goals, not numbers. And that's really what we've tried to focus on, is more of a health coaching and lifestyle coaching, and make it patient-centered.
Yeah, that's fantastic, because it's more collaborative with the patient, using the real-time data. You're doing both coaching, using insights, rather than, like you referred several years ago, it was just coaching and hoping that the patient complies with it.
Right, or hoping they pick up the phone, right?
Yeah,
so
exactly.
We're building really intimate relationships with our patients.
That's fantastic. That all sounds so exciting. Anything else that you'd like to add or share about MD Revolution?
No, I'm really excited that we got to talk, and we're really excited about our partnership. And obviously, health systems are a great opportunity to affect a lot of lives. It typically takes a lot longer to get our initiatives through and work with the health systems, but we have several that we've been very successful with, and we're excited to expand to more.
That's fantastic. Thank you so much for your time, Paul.
Thank you.
Thank you.